Over the last 7 years, we've heard a lot from the Republicans about repeal and replace. They voted some 67 times to repeal the Affordable Health Care Act, which they call Obamacare. Now we've seen their so-called replacement plan. Actually, it's actually a plan to gut the Affordable Health Care Act and stuff through massive tax breaks for the wealthy. What's new? That's the number 1, 2, and 3 priorities of the current Republican majority here in the House of Representatives. They got an analysis Monday. It was a little discouraging, but not really. The Speaker touted the fact it would reduce the deficit by $377 billion. Sure, if you take away health care from 24 million people, you can save some money on that end, but you lose a lot on the other end. With families going bankrupt, the most frequent cause of bankruptcy in America was an uninsured health care emergency before the Affordable Health Care Act. Small rural hospitals will be closing their doors all across America if this bill goes through, and even the larger hospitals, having to give more uninsured care to people in crisis, will be having to jack up prices, and of course that means higher premiums for everybody else. Back to the good old days, freedom to choose. In this case, the freedom to choose bankruptcy or death, or who knows what else under this plan. Now, they have really painted a target on older Americans. They're going to allow the healthcare insurance industry, which, by the way, is exempt from antitrust law, so it's not competitive. They keep saying competition and choice. How do you have competition when an industry does and is allowed to collude to set prices, to exclude certain areas or people from coverage, certain diseases from coverage? They can do that all behind closed doors. It's legal for that industry, and they will not include a provision to take away their antitrust immunity as part of this bill. So, they're going to allow insurance companies to charge anybody age 50 or older 5 times the premium for a younger person. Now, let's look at, say, a modest income 21-year-old, $27,000 a year. They will actually pay $250 less for a policy that will cover less. But, hey, you know, that's okay, I guess, you know, sort of, maybe. But for a 64-year-old earning the same amount of money, and there are 64-year-olds out there still working, can't get Medicare yet, don't have a big retirement fund, they're still working for modest wages, $27,000 a year. They will see their health care costs go from $1,700 a year to $14,600. So a 64-year-old American working person with an income of $27,000 would have a premium of $14,600. Now, how's that going to work? How is that going to work? More than half of their income going to pay for a health insurance plan. They have put a target square on those millions of people, and that is absolutely outrageous. This bill is tax cuts very, very thinly disguised as the American Health Care Act. The cuts are pretty astounding. If you earn $700,000 a year, you will get a $37,000 tax cut. Now, those people are really hurting. You know, those people at $700,000 a year, they're worried about their health insurance. No, not so much. They probably get it for free through their corporate connections or whatever. And even if they did, you know, $772,000, they can afford the increase. $37,000 tax break. But then how about the most privileged of the privileged of the privileged? Those in the top 1% whose income averages $4 million a year. They get a tax cut of $207,000 a year under this bill. This bill is tax cuts disguised as an excuse for replacement for the the ACA. Now, there are a few other tax cuts, again, really deserving and needy folks. Pharmaceutical industry, $25 billion. Medical device industry, $20 billion. And health insurance companies, exempt from antitrust law, can once again pay their CEOs $5 or $10 million a year and take a full tax deduction, which under current law they can't. So here it is, the goodie bag. Tax cuts for the wealthiest among us, tax cuts for the pharmaceutical industry, health insurance industry, medical device manufacturers, and for the rest of America, the booby prize, which is health care plans that cover less and cost a lot more. Oh, and then a couple of years out, 14 million people will be cut off of Medicaid. These are really expensive tax cuts, and they've got to be paid for. The Republicans are fiscally responsible. They're going to pay for the tax cuts for people who earn $1 million a year. They're going to pay for, the tax cuts for the pharmaceutical industry.
The gentleman's time has expired.
But they have to screw a hell of a lot of people to do it.
The gentleman's time has expired.